You got it, my friend. We're going to do potassium, sodium, chloride, magnesium, how it functions in the body and what happens when it's hyper and when it's hypo. So let's start with potassium. You know the regular levels are 3.5 to 5. Now when it is hyper, that means it's over 5. You have like a tight feeling in your chest. Your heart is contracted. You have the ST elevation and peaked T waves in a little beep EKG. You can actually go into a cardiac standstill or VFib, which is very bad. And you can have hypotension, bradycardia. Now in the GI tract, again, tight, contracted. You get diarrhea, hyperactive bowel sounds. You can have neuromuscular issues, so paralysis in the extremities or cramps in the extremities, muscle weakness, or feeling like your muscles are heavy. That's hyperkalemia. High. Now we're talking about hypokalemia. Your heart is slow and low. You have flat T waves. ST, a depression. You actually have a prominent U wave. Your muscles feel slow, you get cramping, you can have that flaccid paralysis of your muscles. And then GI tract, again, low and slow. You have decreased motility, hypoactive, absent bowel sounds, is super constipated. You can actually have a paralytic ileus. Sodium, normal levels, 135 to 145. By the way, I'm reading from my little paper, my little cheat sheet from my NCLEX course. High sodium, you're going to have hypernatremia, you're going to be super bloated, your skin's going to be flush and rosy, you're going to have edema, you could have a low grade fever, you have like polydyspsia where you feel super thirsty. Actually, I feel really thirsty now. You can get dry mouth, nausea, vomiting, increased muscle tone, swollen tongue. Now hyponatremia below 135 is you're going to be like depressed, deflated, seizures, coma, tachycardia, weak thready pulses, and you could have respiratory arrest. Chloride, super best friends with sodium. They're always together. 95 to 107 is the normal range. Hyper over 107, it's the same as like high sodium. Hypo below 95, same as low sodium. Magnesium, 1.3 to 2.1 or 2, depending if you are in France. Hypermagnesium, you're gonna have a cardiac block, prolonged PR intervals, bradycardia, hypotension. You're going to have like shallow respirations, depressed shallow respirations, hypoactive bowel sounds. Hypomagnesium, your heart goes insane. You're gonna have ST depression, T inversion. You're going to go into VFib, tachycardia. You actually can have abnormal eye movements where you're just like, and diarrhea in your GI tract. I'll do solutions next.